Hi, this is Vanaja. I'm an OBGYN by the profession. Like we all know, pandemic has been stressful for all of us for the past year and a half. So during this time period, I did pick up a couple hobbies. One of them is yoga. Of course, been there for several years. I used to do it a little bit on and off, but lately I've been doing it more consistently. Like we all know, yoga does improve both physical and mental well-being. And I do see changes in myself, keeps me more calmer, helps me manage the stress better way, more energy, more flexibility. And I do recommend to a lot of my patients when they talk about how to cope up with the stress through this pandemic. And of course, the other one I picked up is gardening. It's another way of keeping your mind diverted, and you do get some physical workout, and of course, get to eat more fresh, farm-raised, healthy vegetables. Hoping to carry both of them in the future. Thank you.
That's right, yoga and gardening for the win. Beams, y'all. My name is Andrew Defy, aka the Gorilla Poet Laureate, aka the Hoodie God, aka Spitting Quarantino, aka I wear my sunglasses indoors at night because my eyes are as sensitive as my heart is, y'all. And welcome to another episode of the internet's favorite community health live stream. We've got another banger for you tonight as we take a look at the Delta variant in the U.S., healthcare system transparency, the effects of racism in the workplace, and how climate change is affecting our health. Yeah, we're going deep this episode. All that and an interview with Dr. Charity Dean, the CEO and a co-founder of the Public Health Company. Before that, she worked as the assistant director for the California Department of Public Health. So it's safe to say she's an expert in the arena of public health. So we're going to talk reopening as well as preparation for future pandemics. Y'all, stay tuned. It all starts now. So as the country slowly opens back up and pockets are being hit with this new Delta variant and struggling, particularly in the Midwest, we are seeing a growing number of cases. Check out this report from NBC News.
Tonight, after large 4th of July gatherings, in some pockets of the country, there's little reason to celebrate. The Delta variant is fueling a worrisome rise in COVID cases, now being recorded in a third of all states. Where vaccination rates are low, infections are exploding. In Missouri over the weekend, one hospital treating COVID patients briefly ran out of ventilators. In the past 2 weeks, cases here have risen nearly 50%, and COVID wards are reopening.
This time is not only faster, but it's more aggressive. People is getting sicker quicker, and we are seeing an increased amount of sickness in a younger population.
Even where vaccination rates are high, like California, in May, Delta accounted for 5% of all cases. Now that number has ballooned to 35%. Experts who say you didn't need a mask indoors say now you should probably wear one. With restrictions being lifted nationwide, tonight the president says the fight against the virus isn't over yet.
As I speak to you, millions of Americans are still unvaccinated and unprotected. And because of that, their communities are at risk, their friends are at risk, the people that they care about are at risk.
As vaccination rates stall, the CDC confirms they're investigating the death of a 13-year-old Michigan boy days after his second dose. Authorities say it's far too early to connect the vaccine to his cause of death and stress tonight it's vaccines that are saving lives. Miguel Almaguer, NBC News.
So this story comes to us from the Kaiser Health News website. A Trump administration price transparency rule that took effect at the start of this year requires hospitals to post a range of actual prices, everything from the rates they offer cash-paying customers to costs negotiated with insurers. Many have complied, but some hospitals bury the data deep on their websites or have not included all the categories of prices required, according to industry analysts. A sizable minority of hospitals have not disclosed the information at all. While imperfect and potentially of limited use right now to the average consumer, this trove is nonetheless eye-opening as an illustration of the huge differences in prices nationally, regionally, and within the same hospital. It's challenging for consumers and employers to use, giving a boost to a cottage industry that analyzes the data, which in turn could be weaponized for use in negotiations among hospitals, employers, and insurers. Ultimately, the unanswered question is whether price transparency will lead to overall lower prices. In theory, releasing prices may prompt consumers to shop around, weighing cost and quality. Perhaps they could save a few $100s by getting their surgery or imaging test across town instead of at the nearby clinic or hospital, but typically, consumers don't comparison shop, preferring to choose convenience or the provider their doctor recommends. A recent Peterson KFF Health System Tracker brief, for instance, found that 85% of adults said that they had not researched online the price of a hospital treatment. And hospitals say the transparency push alone won't help consumers much because each patient is different, and individual deductibles and insurance plans complicate matters. Under the Trump era rule, hospitals must post what they accept from all insurers for thousands of line items, including each drug, procedure, or treatment they provide. The negotiated rates now being posted publicly often show an individual hospital accepting a wide range of prices for the same service, depending on the insurer, often based on how much negotiating power each has in a market. In some cases, the cash-only price is less than what insurers pay, and prices may vary widely within the same city or region. Patients can try to find the price information themselves by searching hospital websites, but even locating the correct tab on a hospital's website can be tricky. Here's one tip. You can Google the hospital name and the words price transparency and see where that takes you, said Caitlin Sheets, director and head of analytics at the consulting firm ADVI Health in the Washington, D.C. area. As for compliance, we're seeing the range of the spectrum, said Jeffrey Liebach, a partner at the consulting firm Guidehouse, which found earlier this year that about 60% of the 1,000 hospitals surveyed had posted at least some data, but 30% had reported nothing at all. Many in the hospital industry have long fought transparency efforts, even filing a lawsuit to block the new rule. The suit was dismissed by a federal judge last year. Insurers and hospitals are also bracing for next year when even more data is set to come online. Insurers will be required to post negotiated prices for medical care across a broader range of facilities, including clinics and doctors' offices. In May, the Centers for Medicare and Medicaid Services sent letters to some of the hospitals that have not complied, giving them 90 days to do so or to potentially face penalties, including a $300 a day fine. A lot of members say until hospitals are fully compliant, our ability to use the data is limited, said Sean Grimminger, Director of Health Policy at the Purchaser Business Group on Health, a coalition of large employers. His group and others have called for increasing the penalty for non-complying hospitals from $300 a day to $300 a bed per day, so the fine would be bigger as the hospital gets bigger, Grimminger said. That's the kind of thing they take seriously. Our guest tonight is the CEO and one of the co-founders of the Public Health Company. She also served as the assistant director for the California Department of Public Health and was a key member of the executive team directing the COVID-19 outbreak response in California. She's a real-life superhero who really helped our state get a jump on the COVID-19 crisis. Y'all, welcome Dr. Charity Dean to the show. Dr. Charity Dean, how are you doing?
I'm doing great. Happy to be here.
I'm so excited to have you here because in addition to being a physician, you are incredibly involved in public health and disease prevention. Let's start off, can you tell us what led you to pursue a career in public health in addition to your role as a physician?
You know, I have always been obsessed with outbreaks ever since I was a child. And I studied microbiology in my undergraduate. And then I did a master's in tropical medicine. And so even though I initially went into general surgery, when it was clear to me that I really wanted to be dealing with diseases, public health was a very natural fit. I grew up as a poor kid in rural Oregon and relied on many of the government safety net systems from the county public health department and county services. And so it was a natural fit for me joining the county public health department. Honestly, I felt like I was home.
So you are the CEO and co-founder of the public health company, the first company to consult businesses and communities about what they can do to stay protected from infectious disease. What inspired you to start the public health company?
You know, honestly, I was inspired to start it by being part of the team leading the response for California and seeing how the technology, the software that we really needed for disease forecasting and knowing how a disease was moving through the population, that software didn't exist. And working with many of the volunteers from Silicon Valley that came in to help state government was a real turning point for me of realizing that this capability needed to exist, and it needed to exist in software that was accessible to all, public sector, private sector, communities. And so after thinking about it deeply, I knew that that's what I had to do. And so when I left my position with the state, it was a really hard decision. I absolutely love public service. But what I know our country needs is the kind of technology that can come from Silicon Valley that's going to revolutionize disease control. And so that's exactly what we're building.
You were recently featured in Michael Lewis's book, The Premonition, which discusses how you and several others were the first to sound the alarm about COVID-19 before others were willing to really acknowledge it as a threat. Moving forward, what should we be doing to better prepare for future pandemics?
You know, I think that's the most important question the country and the world is asking right now. There were amazing people, public servants, volunteers in the private sector. There are many heroes in the COVID-19 pandemic response. The challenge is if the underlying system doesn't enable them to do what they need to do, then the whole response is going to fall short of where we want it. And so in re-envisioning a US public health capability for disease control, the direction I believe we need to head is using technology, using the kind of Silicon Valley technology that's revolutionized other sectors. Again, that's what motivated me to launch a technology company and start to build it. It's not the only part of the solution. There are other pieces to this solution, like looking at our operational infrastructure, or do the right people have the authority to take the right action on the front lines to contain this? But technology is absolutely at the core of what the United States needs to build.
And as California begins to reopen, many Californians are seeing this as a return to normalcy for vaccinated individuals. Is it safe to return fully back to normal, or should we be taking precautions? Like, where are we in all of this?
Yeah, it's a really important question. And the answer is going to depend on how the disease is spreading through certain regions and what their vaccination rate is. So to specifically answer your question, for an individual who is fully vaccinated and doesn't have underlying immunocompromising conditions, in other words, they're fully vaccinated and they're going to be protected in the vast majority of cases against getting infected with the virus or getting sick from it, it is reasonable that people in that situation can resume normal activities. However, we are watching the rise of the Delta variant in the United States. For those that don't know, the Delta variant is a new flavor of COVID. The virus has mutated, and it is far more transmissible than the prior virus types that we saw. What that means is it's going to spread much faster. It's going to spread much faster among people who are not vaccinated. Unfortunately, there are states and pockets, communities within the United States that are under vaccinated right now. And that means they're going to be vulnerable to the Delta variant infecting many unvaccinated people. So for people who are fully vaccinated, it is reasonable to say that if you're in a part of the country like San Francisco, for example, many communities in California that have lifted mask mandates, are trying to get back to normal, it makes a lot of sense that people want to do that. I want to do that too. But I also know that we have to consider the underlying vaccination rate of the community and the immune status of the people around you. And that's what I would say also to motivate people to get vaccinated. Getting vaccinated is the single most important thing we can do right now to make sure we can all get back to life as normal.
You know, that was going to be my next question. You know, for our family who are still wary about getting vaccinated, what can we do to help dispel fears regarding vaccine safety?
You know, I think the most important part of concerns around vaccines always comes down to trust. Trusted leaders in a community. It might be a soccer coach. It might be a community of faith, a faith leader in a synagogue or in a church who's really trusted among that congregation or that population. We need those trusted leaders to speak up and speak out and encourage people to get vaccinated. The other thing is access. Not everyone has the internet. Not everyone has a car to drive to a vaccine site. And so making vaccines more accessible by going out into the community and bringing vaccines at mobile clinics, for example, or again, you know, to use the example of communities of faith, offering them at places where people gather, spreading the word that they're free and that they're safe. Those are the kind of things we need to be doing, especially in vulnerable populations right now that are under-vaccinated.
So I have one last question for you, and it is the question I ask everyone who comes on this show, because I am an expert joy hunter, and I am always trying to figure out where other people are finding theirs. So where are you finding joy today?
Where am I finding joy today? You know, I find joy in two places, really. I'm an introvert, believe it or not. I love my quiet time out in nature. Having a daily quiet time to recharge my battery and remind myself what's important. The other source of joy, though, is working with the amazing humans on my team. I have always loved the teams that I work with. Everything I've ever accomplished professionally was never done alone. It was always done as part of a team. And the team that I work with today are phenomenal. Every one of them are funny and smart and thoughtful and committed to the mission of protecting communities. And it fills me with joy every day.
And thank you to you and all of those teams for everything that you've done and everything you continue to do for our community as a nation, right? So just thank you for joining us today. This was all very, very enlightening, and we appreciate your time and energy. And we'll have to have you back on as we continue, maybe once we get to the other side of this, to talk about all of it. So thank you so much, Dr. Dean, and we'll talk to you soon.
It's my pleasure.
This next story comes to us from U.S. News. More than a third of Black workers report being treated unfairly in the workplace in the last year because of their race or ethnicity, a new survey released Monday by the Society of Human Resource Management found. That number rises to 42% for Black workers over a longer time period of 5 years. The Cost of Racial Injustice report found the percentages for Asian workers was 26%, while 21% of Hispanic or Latino workers said they were unfairly treated during the 5-year period. For white workers, the number was 12%. The coronavirus has disproportionately affected workers of color, as the economic lockdowns that resulted from it most directly affected the lower income service sector, in which Black and Hispanic workers are clustered. The past year has also seen a spike in anti-Asian crimes and abuse, stoked in part by the false characterization of COVID-19 as the China flu. The report put a price tag of $172 billion with a B as the cost of turnover due to racism in the workplace over the past 5 years. Many workers reported feeling angry at the treatment they suffered, often suffering anxiety or stress that reduced their productivity. In the past year, the survey found that racism may have cost American businesses $54 billion in absenteeism and $59 billion in lost productivity. If you've been outside at all in the last week, then you know that California is riding a major heat wave with temperatures up in the 110s around the state this past weekend. That left us looking for any refuge we could find. Rising temperatures, increased earthquake activity, and more destructive fire seasons are all reasons we in California know that climate change is very real. But what effects does it have on our health? Check this video out from the CDC.
Widespread scientific consensus tells us the world's climate is changing. These changes are creating new health risks in communities across the United States. Extreme weather, unhealthy air quality, and disease outbreaks are becoming more frequent and more severe, affecting more people in more places. Changes to our climate mean our communities need to prepare for the health risks of higher temperatures. Extreme heat can lead to heat stroke, heat cramps, heat exhaustion, dehydration, and death. Anyone can be at risk, but some are more vulnerable, including pregnant women, people with heart or lung conditions, young children, older adults, athletes, and outdoor workers. So how do we prepare for extreme heat? Communities can establish cooling centers, plant trees to lower urban temperatures, and educate residents on ways to protect themselves and others, such as drinking plenty of water and checking on older relatives and neighbors. A changing climate also means more frequent and more severe storms and flooding. That puts people at immediate risk of being injured or killed by debris, downed power lines, or floodwaters. After a severe storm or flooding event, possible health risks are contaminated food or drinking water, bacteria, viruses, and toxic chemicals in floodwaters, mold, and difficulty accessing healthcare services like emergency help, prescribed medications, and supplemental oxygen. In these events, older residents, people with disabilities, and lower-income households are more at risk. They may all have a harder time fleeing from a storm and may face more health risks if they can't evacuate. One thing we often miss, the mental toll. First responders who witness countless tragedies and residents who are forced to flee are more vulnerable to anxiety and depression, even those who have no history of mental illness. To prepare, communities can find out which neighborhoods, people, and resources are most at risk, upgrade infrastructure such as roads and sanitary sewer systems, and educate residents on how to stay safe during and after an extreme weather event, such as avoiding driving in flooded areas. As average temperatures rise across the globe, air quality can also change. That looks like longer and stronger pollen seasons, which can trigger asthma attacks and allergies, hotter temperatures and changing weather patterns, which can make air pollution worse by increasing the density of dangerous particles, and more frequent droughts that can lead to wildfires, which release dangerous pollutants into the air. Young children, people with asthma and respiratory conditions, older adults, and people with compromised immune systems are more at risk of being harmed. Work that can help communities prepare includes collaborating with community partners to set up health-focused air quality alert systems and educating residents on how to check alerts to know when it's safe to exercise outside. Now, let's talk about these little guys, pests. Change to our climate can also mean more risk of diseases spread by pests like ticks, mosquitoes, fleas, and rodents. With higher average temperatures, diseases transmitted by pests can multiply faster, spread to more locations, and infect people over longer periods of time each year.
That brings us to the end of another episode of Masked Up. We want to thank the half of the internet that tunes in every week. We couldn't do it without y'all. I'm Andrew Defy. As always, shout out and big thanks to Netta, Allison, Atul, Esha, and the rest of the Protect Us crew. I can fly higher than an eagle, but y'all are the wind beneath my wings. Like Mozzie said, health is wealth, and I need my bag. Remember, health doesn't come from a pharmacy, y'all. Till next time.